Hi, Dr. Melanie McLaren, talking today about thyroid lab markers that I like to check on patients. So we have TSH, free T4, free T3, reverse T3, and thyroid antibodies. So TSH is your thyroid stimulating hormone that's made in the brain, in the pituitary, and it tells the thyroid, let's make hormones. So as that feedback loop gets louder, the number will elevate. So we like that to be 2 or less optimally. And if the number is elevated, that means you're hypothyroid, low functioning. And then if the number is suppressed, it's an overactive response from the thyroid, which is less common. And then looking at the thyroid hormones, T4 is the first thyroid hormone that is made. So if we look at free T4, that's unbound T4. And then we look at T3, so T4 gets converted into T3, and that's our more active hormone that we feel the most benefits from. So you really want to make sure you check a free T3, unbound T3. Reverse T3 is also something I like to check. That is an inactive hormone, and that can bind up your T3, so it can't function very well and get to the receptor sites. So you could have normal labs with the T3 values around 3 is what I like to see, T4 around 1.2. But if your reverse T3 is 15 or higher, then it could be binding up that T3, so you're not really feeling the effects of it. So there are very particular things we can do to get that working a little bit better. And then I also check thyroid antibodies for autoimmunity. So those can show up to 10 years before they become a problem. So it's really good to get ahead of those and see what's stimulating that immune system. So in looking at all these markers, it's important because you could have a slightly elevated TSH, meaning a little hypothyroid or messaging's gotten louder, but your thyroid hormones all look really good. So there could be something else going on. You could have hormone imbalance, so I like to check sex hormones too. Might be estrogen dominant, and that could interfere with that. This could have some adrenal dysfunction as well. And so if we look at the whole picture, we get everything working the way that it should be, then sometimes that TSH messaging will calm down and everything will be working great. Now, if TSH is very elevated, we also have to look at the patient's symptoms. They're all the symptoms of hypothyroid, low functioning thyroid. Then, sometimes medication may be needed to help them feel better. And that's completely fine. I do use glandulars as much as possible with people. But just making sure we're making the right choice to get everything working optimally, looking at the whole picture. So if you have any questions, definitely reach out. Thank you.